Hey, what's going on? It's Dr. O with another anatomy tutorial. Today we're going to be talking about the knee. Alright, so we've got a specimen, an Asian female to be exact, which is beside the point, really, as we all have the same A and P, you understand what I'm saying? As long as we're Homo sapiens. So check yourself before you wreck yourself. We've got the knee. Knee can be problematic for many people. It's a very weight-bearing joint. So there's just a tremendous amount of force, a very large percentage of our body weight that is borne by our knees. So let's look at the anatomy. We've got the thigh and the leg come together at the knee, essentially. Let's look at some of the muscles and bones. Look at the bones first. Alright, so superiorly or above. Listen, I was going to hide her genitalia, her vulva, but let me tell you something. It's frickin'. You guys are going to have to suck it up. I'm not squeamish about that shit. Alright, so here are the bones. Superiorly, we have the femur, right, left and right, and then inferiorly we have the tibia, shin bone, and then laterally there is the fibula. Lashing all these bones together, of course, we've got ligaments and tendons. Ligaments connecting bone to bone, tendons connecting muscle to bone. We even have these membranes like holding the lower leg together called the interosseous membrane here. It's really neat. So those are the bone structures here. You can see the blood vessels, arteries and veins. Arteries in red, they're carrying oxygenated blood to all the anatomy of the lower extremity. Of course, the nervous system is powering all of this. If I look at the knee itself, right, we've got the patella. Let me shit can that stuff. There you go. Just get the bones in there. So we've got the end of the femur, which is called the distal end. That's the, as opposed to the proximal femur, which is closer to the hip. And then this long bone goes all the way down to the knee, and we've got the femur articulating with the top of the tibia, or shin bone, and we've got laterally, we've got this little bone, thin, called the fibula. And you can feel that on the outside of your ankle. Right. The ends of all long bones are covered with a type of cartilage. It's called hyaline cartilage. It's very cushiony and it is very lubricative. So you hear somebody say, oh, I got bone on bone, I got to do something about that. Bone on bone means that the ends of your long bones are actually, the cartilage is worn away. All right? You can hear sometimes you got to hear pops and clicks and stuff like that. Scratching sound. It's called crepitus. And that'll happen as the years progress, and if you were to sustain any injuries, God forbid. We can see these, all the kind of gray / blue right here, the ends of those long bones, for all of them, both the tibia and the fib and the femur. All those surfaces you see, they're covered in whitish, grayish blue. They're supposed to be cartilage. So that provides a little bit of separation and cushion and lubrication in the joint. And then we've got the patella, or your kneecap, in the center. And those are the meat and potatoes of or the nuts and bolts rather. Meat and potatoes, nuts and bolts, what have you, of the knee. Some of the common injuries of the knee, most of them are soft tissue in nature. So strains of muscles, sprains of tendons and ligaments, inflammation, kind of run-of-the-mill inflammation, just with all the friction, given all the friction that occurs at the knee. There's one condition called PFPS. It's otherwise known as patellofemoral pain syndrome, which means like friction. So if you bend and extend your knee and move and groove and climb stairs and run and walk and all that stuff, up and down, all around, there's a lot of friction that just occurs in that movement, particularly between the patella and the femur here. So there's a little groove that the patella fits in right in the top, a little shallow depression just on the distal end of the femur. And constantly, the patella's constant movement in all those situations can just accumulate a lot of friction. Chronic friction can lead to inflammation, where the white blood cells go in there and try to clean up the area and just cool things down, trying to heal the area. But if the problem is not removed, which could be a problem at the foot, some sort of mechanical issue, some sort of overuse injury, then it could persist and even get worse. So there's PFPS. There's another thing called chondromalacia patella, where the underside of the kneecap is lined with that cartilage too, and that can get scraped away over the years. Let's say you're somebody who, like I had a patient he was a candy man. He filled candy machines, and he would always take a knee, usually on the right side. So if you looked at his knee and felt it, you could feel that it was larger and in charger for all those times he took a right knee loading vending machines. You can imagine that the underside of the kneecap didn't like this very much, scraped away the cartilage and caused some problems. So chondromalacia patella is an issue that is at the root of a lot of problems at the knee. I said strained sprains of muscles. I'll talk about them in a moment. Tendons and ligaments in the knee. We've got something called the meniscus, which sits right at the top of the tibia here, right on the top of that. I wish I could bend this bone here, bend this joint. Probably is a feature on here that allows me to do that. But you can see how these smooth, rounded structures, they're called the condyles. They fit right into the top of the knee, and when you bend and extend, they're coming together with that cartilage, and they're nestled in this little area called the meniscus, which looks like a figure eight. It's like a figure eight right on the top of the knee. And that kind of gives a nice seat for the bones to come together. And you can tear those meniscus. You can have a partial or full thickness tear, and in which case you're looking at arthroscopic surgery. There's also ligaments that hold, like in a crisscross fashion, that hold the femur and the tibia together. They're called the cruciate ligaments because they cross, means cruciate. And there's an ACL, anterior cruciate ligament, and a PCL, posterior cruciate ligament. And they will check kind of like forward to back. They'll make sure that your femur does not drop off the top of your shin bone, or vice versa. Kind of hold the knee together, maintain its integrity. Back of the knee is called the popliteal region. There's an artery and a nerve of the same name back there. And the front of the knee we call the patellar region because you got that kneecap there. And something that should be mentioned about females is that the angle that the hip, that the thigh bone or the femur comes together at the knee, see there's that straight line and this straight line, there's more of an acute angle here in females given the wider hips. All right, characteristically wider hips for childbirth. Let me add some. There you go. So now if I'm adding some anatomy from the bones, I've got the kneecap is actually called the patella, and it's categorized as a sesamoid bone. It develops inside of a tendon, this tendon here called the patellar tendon. And there are other sesamoid bones that are much smaller throughout the body. The kneecap is about mechanical advantage. It provides a little extra power at the knee. You see the thigh muscles come in. Some of them we know, like the quadricep is a big, powerful four-part muscle of the thigh. Really helpful in squats and rising from a seated to standing position. The muscle mass of this particular specimen is not very high, it's not very robust, you know what I'm saying? But I can see the quadricep very distinctly there. Big, powerful muscles of the thigh, burn a lot of calories. Important to keep them big and strong. Then we have the shin muscles, like the tibialis anterior. Make sure you clear your toes so you don't trip over your feet when you walk. And then there's, on the lateral aspect, there's this white structure. It's actually part of a muscle. The tensor fasciae latae muscle starts up here, and then it'll become this thickened ligamentous structure. That's called the iliotibial band. So that can attach to the side of the knee here. That's where it's going to insert. So it comes across the knee and attaches on the shin. And that can really become inflamed, particularly in runners. The calf muscles from the posterior, we've got the gastrocnemius, which is this rounded muscle that is kind of superiorly located. And if I take that off, there's a muscle deep to that called the soleus. So they both attach to the Achilles tendon, to the heel via the Achilles tendon. So that's the gastrocnemius right there. And then the hamstring muscle group. There are 3 hamstring muscles you're looking at there. 1, 2, 3, lateral to medial. This should be the biceps femoris, semimembranosus, and semitendinosus. So this would be the semitendinosus and the semimembranosus there. And they both attach to the what's called the ischial tuberosity. I'll show you. Both of them attach right to the bottom of the pelvis. There's the anus, is staring us right in the friggin' face. So the hamstring muscle group, we can add the glutes on there, gluteus maximus right there. Pretty cool. So to summarize, we've got some very important muscles and bones comprising the knee. We've got cartilage lining the knee. We've got inflammation and pain that can result because it's a very weight-bearing joint. I use the analogy, it's kind of like you've got a pencil eraser, and the amount of pressure you place downward onto that surface, the table, let's say, and move back and forth, that's going to dictate how much wear and tear is in the knee. So cartilage can get worn away if we had to practice weight control and daily exercise, and flexibility and strength training are all going to injury-proof us for our entire body, especially the lower extremity. You got to be long to be strong. So if somebody's inflexible, let's say doing a hamstring stretch where you can't squat down without rising up on your toes, or you can't go into a deep squat without extreme pain, or your body composition is starting to get very unfavorable and in other words, you're getting fat and out of shape, you could be experiencing some knee problems at some point in time in your life. You also hear about a lot of professional athletes having injuries to their ACLs. Oh, I blew out my ACL. So that's that cruciate ligament. You cross your fingers. Imagine that 2 ligaments about the size of pencils crossing and holding the knee together so it doesn't fall apart like a friggin' doll's leg. Remember that chondromalacia from the underside of the kneecap. Strengthening, resting the knee, getting good regular flexibility and weight-bearing exercise is extremely important. Also, is a word about cartilage. It doesn't have a direct blood supply, so cartilage relies upon diffusion, a passive process, kind of like you squeeze the fluid out of a sponge and then place it on a surface where there's some water. It drinks it in. So fusion needs loading and unloading. So movement. Movement is life. Always remember that. Take care of your knees. You got to be friggin' stretching out like a yogi. You got to maintain a healthy weight. You got to exercise regularly. You got to eat properly. And your knees will last you a very, very long time. Now, orthopedically speaking, they're doing partial knee replacements. So the most common areas to become arthritic in a knee are actually the medial aspect. So this part if you got arthritis in the knee, and I look at your X-rays or MRIs, chances are the cartilage is probably worn away on this side. So sometimes they can treat that and it'll get better. And sometimes if the pain is unrelenting, maybe you need to get a knee replacement. Maybe they can do it piecemeal, and friggin' it could be a game changer, give you mobility, and make sure that that dysfunction does not travel up to the hip and the back, and so on and so forth. Here's your intestines, by the way. Pretty friggin' cool. And your reproductive organs down here. Stomach. Heart and lungs. Kidneys. Bladder. Uterus back there, you see that? Uterus and the ovaries. Pretty friggin' fierce.